Hey, Josh, are you there?
Hey, Josiah, good morning.
Hey, how are you?
Good, good. Saw you got dialed in.
I did. Sorry about that confusion this morning. I went to my calendar and realized all I had on there was the hold, and I saw it and thought it was the actual invite. I was like, oh, no.
Oh, no problem. No problem at all. So you see a spot where you can share your screen there?
Yeah, so do I just click share whenever I'm ready?
Whenever you're ready, yep, you just click share, and then it'll ask you, if you're on multiple monitors, it'll just ask you which monitor to share, and then you'll have full control. So I think what I'll do is I'll let you go ahead and have your desktop up and ready, and then I'll just do a quick introduction, introduce you and Kelly, and then give a little bit of just an overview of the brokerage and who we are and some of our local partners, and then let you run with it till the end of the end of the call. And then what we can do is everybody will have a muted line, but we can tell them to put their questions in chat, and then I can read off the question and just let you guys answer it, or if it's regarding the FMO contracting, then of course I can take those calls or those questions.
Perfect. Well, I have a total of, I think, about 10 slides, and so we're hoping to be through them in, maybe 10 to 15 minutes max, 15 minutes max. So I know we only have 30 minutes. I want a lot of time for questions. I figured they have probably a lot of questions, so.
Yep, sounds good.
And if you want, sorry, are you going to present any slides at all?
No, I'll just use your slides. Yeah.
I'm just going to go ahead and share my my screen. Are you okay with that?
Yes, you absolutely can.
And then you can tell me, make sure it's all. Can you see my screen now?
Sure can.
Perfect. I'll just leave it up like that. That way, when we're ready, I can click through.
Looks perfect.
And if you want, I'll just show you real quick. So we've got just brief CommunityCare overview, our owners, and a brief overview of our two owners. Some, why now, but I'm going to run through, why after 25, 26 years of being in business are we using brokers now, and sort of our reason behind it. And this might be a point where if you want to insert anything about the FMOs, then please do. I'll try to pause it when we go through the point number 3. The only way we're going to get there is through agents and strategic channel partnerships. So our service area map, product highlights. This is where, as I talked to you, I just included what will be included, but not the actual level for any of them. Commission schedule, and then I was going to go and address here why in the contract it says 120 days post effective date. I figured they'll probably have questions about why not sooner, and I'll let them know our goal is to pay as soon as possible, but we wanted to give ourselves time depending on CMS feedback. Some of the things we're setting out, the phone line, email, and then our overall service, and then timeline of events for next.
Perfect.
And that's it.
Will you talk anything about benefits?
Yeah, on this slide here.
Okay, perfect.
Is where I'll cover and we're only including the the high level stuff. I figure at the August 28th, I think that's the date. That's where we'll have the full breakdown of all the benefits.
Perfect. Well, I think some others have dialed in. So for those of you that have dialed in, thank you for joining this morning. We'll get started here in about 6 minutes or so. Everybody's in a listen-only mode. So if you have any questions that come up during the webinar, feel free to put them in the chat, and we'll make sure to get those answered as we move through the presentation. So Josiah, hang tight here for another 5 minutes or so, and we'll jump right in and get started.
You got it. Thank you.
Well, good morning, everybody, and thank you for dialing in. My name is Josh Slattery, and I'm with the Brokerage Inc. And I'm joined here this morning by Josiah Sutton and Kelly McEver from CommunityCare. And we're very excited to announce our partnership with CommunityCare for this upcoming year. As many of you have probably heard, this will be the first time that you'll be able to contract with CommunityCare as an external agent. So we're extremely excited about that partnership, and we're accepting contracts today. When you contract through the brokerage, I just wanted to give you a couple of pieces of information to know about us and about the services that we provide. But when you contract with us, you're going to own your book of business. So any of the business you write, you are 100% vested from day one. And we've set up arrangements with CommunityCare to where you're paid directly by CommunityCare. They will pay all of the agent commissions directly. So then again, you know that you own that block of business and you're not being paid as a solicitor or agent. We have a lot of marketing programs, and I'm not going to spend a lot of time today talking about it, but I encourage you to reach out to us to learn more. Our flagship marketing program is called Brokerage Bucks, and basically how this operates is that if you write 8 pieces of business, whether that be a Medicare supplement, Medicare Advantage, final expense, ACA, any type of product that we offer, but if you write 8 effective dates for an upcoming month, and we will give you a 1,000-piece mail campaign or a $450 marketing allowance. So that could be put towards anything like retail operations or community meetings or events that you may do out there in the community. However you want to spend those marketing dollars, you could do 1,000 pieces of a CommunityCare flyer this upcoming AEP. We will also market any of your seminars. So if you decide to do any CommunityCare seminars this upcoming AEP, at no cost to you, we will market those for you and attract people into your meetings. We also cover your E&O. So any contracts that you might have under the brokerage, we will cover your errors and omissions. We also give you access to our online enrollment tool, also known as Connecture, where you can do e-apps with all major carriers. You have access to our quoting engine. So once you log into our website, www.brokerageinc.com, you can actually request contracting links to CommunityCare and any other carriers through that online system, as well as gain access to all of our quoting engines, Medicare supplement quoting engines, Medicare Advantage, final expense. All that's unlocked when you get onto our website and get approved as an agent with the brokerage. We also have local support. We're that national carrier with local support, and we operate through 3 different key agencies within the Oklahoma area. One is Local Insurance Advisors, and that's through Tom Mays and Travis Branch. We also partner with Tallgrass Benefits through Michael Stevens, and then lastly, Centennial Insurance through Craig Corbett. So without further ado, I'm going to turn it over today to Josiah Sutton to walk us through CommunityCare program for this upcoming year. And again, we really appreciate everybody attending today. If you're wanting to ask any questions, you are in a listen-only mode, so please put any questions you may have into the chat, and we will answer your questions as we move through the presentation. So Josiah, take it over.
Very good. Josh, thank you so much, and thanks for setting this up. This is, as Josh mentioned, not only a very new thing for CommunityCare that we are extremely excited about, the first time in our 26-year history that we will finally allow agents to sell our Medicare Advantage product. But in addition, this is our first inaugural launch to agents officially in partnership with the brokerage firm. We're very excited in our partnership with them and have been very impressed and pleased with the quality of all that they've done, whether reviewing marketing materials or even advice back to CommunityCare. Very appreciative of the partnership, Josh, so thanks so much.
Thank you.
So we'll jump right into the first slide here, and I wanted to paint a picture not only of who CommunityCare is, but later on we'll get into our owners and how we're structured and some other information. So as you can see here, it's actually 26 years now. Not quite, so over 25 years of experience serving the Oklahoma community. Obviously, we're predominantly in Northeast Oklahoma for all of our lines of business. Medicare specifically, we've got a map later on. Medicare specifically is definitely only in Northeast Oklahoma for now. We have plans to expand in the future, but right now for the 2020 plan year will be Northeast Oklahoma. And we have a very unique partnership with our two owners, as you're aware, St. Francis Health System and Ascension St. John. They both own CommunityCare 50/50, and they fully underwrite all of our profits or losses. So we are fully backed financially by both of those health systems, and those two health systems are very strong financially. Over the past 25 years, CommunityCare has built up a significant reserve, and so we are also very financially strong in everything we're doing. Even though we lost technically a star rating and lost significant revenue from that, we actually reinvested into our product lines that you'll see later on to decrease our premiums for 2020 as well as enhance our benefits, which is obviously a very, very rare thing to have happen. So we are doubling down in our Medicare Advantage, but it's all through our owner partnership. And they've really challenged us as Medicare Advantage continues to grow and is such a large part of CommunityCare's block of business, but also a large part of what both health systems partake in. They've really challenged us to revamp our entire Medicare program, and obviously one of the leading requests we had was to use agents moving forward. So we're very happy they approved that. And then obviously, as you all know, quality matters a lot whenever it comes to taking care of any member, but definitely Medicare beneficiaries. And so both of our owners were tied in a three-way tie, according to U.S. News and World Report, for the best hospital system in Oklahoma. So we're very happy to have such strong owners in quality and their financial strength as well. So here you'll see the two owners that we have, and just a little bit of information about both of them. You know, between both owners, there's almost 2,000 total physicians that are within their health systems alone. And then on top of that, we obviously wrap with a lot of other physician groups and independent physicians to make up our network. We have a very robust network within Northeast Oklahoma, whether it's specialists, primary care. And then what's great is because we are owned by both health systems, whenever there's a member that comes through one of our owners' doors and is a CommunityCare member, there's a lot of back and forth that goes on between our chief medical officer and the owners. There's meetings that happen 3 times every single month where physician leaders from CommunityCare, St. Francis Health System, and Ascension St. John are all sitting down and discussing ways that we can improve the quality outcomes of our collective members. And it even goes so far, and this is not a marketing spiel at all, and we will never include it in our marketing materials because it's not something we offer across the board. But even if a member were to walk in and a CommunityCare member were to go into one of our owners and could not afford to pay their copay, our owners work very closely with them to either just write it completely off or work out a payment plan. And it's something they do for CommunityCare members because they realize they're at risk for those members regardless. And so there's not that normal fee-for-service provider versus insurance dynamic that you would normally have. So we're very proud of that. So obviously the big question we've been asked a lot as we've been talking to Josh and other agents is, well, why now? You know, CommunityCare, you've had 25 years to leverage agents. Why now? And there's a lot of reasons. One, Medicare is the fastest growing line of business, not only within CommunityCare's portfolio, but nationwide. Medicare Advantage specifically now accounts for over 34% of total Medicare enrollees. From a CommunityCare standpoint with our owners, as I mentioned earlier, it's a significant amount of their business. And so they want to make sure that CommunityCare is setting themselves up and preparing for the future as Medicare and Medicare Advantage continues to grow. Recently, Secretary Alex Azar did a conference and was talking about how in the past they would always rely on fee-for-service Medicare, original Medicare to innovate and sort of set the groundwork, and then Medicare Advantage and supplemental and everything else would flow behind. And he said, you know, over the next several years as this growth continues, Medicare Advantage is going to be the dominant player, and original Medicare will follow behind the innovations that Medicare Advantage will develop across the country. So obviously hearing comments like that, seeing the growth, we realized it was time to really get serious about our growth. And every year, CommunityCare has had net positive growth. but it's been in the low single digits. Our retention rate, so in certain counties, we're over 50% penetrated in Medicare Advantage, and with the growth rate being a couple percentage points, where we've really benefited is our retention rate is as low as 2%, or as high as 2%, I guess you could say. The nationwide average is closer to 12 to 14%. So when we retain so many of our members, we've been able to sustain a very low growth rate because we had such a high retention rate. Moving forward, our owners said, okay, what's it going to take to grow in the double-digit range? And our very first, Kelly and I, our very first response was, we have to use agents. If you want to grow at that rate and then also retain and provide the ongoing service, agents and strategic partnerships like our partnership with the brokerage are the only way for us to get there. And it was unanimous approval by our board for us to pursue an agent model. So we're very excited about that, about this moving forward. And then in the future, we are looking at expanding to new counties. This is a map of our current service area. But we are looking at Rogers and Mays specifically for 2021, with the possibility of going even further south, Okmulgee and others. So the total service area map you see here is our commercial service area for our large group, small group lines of business, but the shaded areas are our Medicare Advantage filed service area. We're happy to provide other materials as we move along. Like I said, this is our inaugural launch. We can provide a map that has all of the dots for both primary care, stars for facility locations, and then other dots for specialty providers. So this is a small sampling of our 2020 product line. We are only showing our Silver Plus, which is our no premium plan, and then our Platinum, which is our buy-up plan. So I'll start with Silver Plus, obviously no premium. It's a primary care visit of $5 copays, and then specialist at $20. So the specialist we know is unique to the market compared to other plans and what they've had in the past. We've left that low, and you can see it's the same in our Platinum as well. We've left that low because the majority of our utilization for our specialist needs are all within our owner facilities. So we have a unique advantage and feel confident leaving that copay low without having any sort of adverse selection. Lab and X-ray is at $0. This was at 20%, or is at 20% right now. We dropped that to no charge for lab and X-ray in 2020. Our outpatient surgery is $200. That was a $300 copay prior. And then our out-of-pocket maximum is at $5,900. We reduced that from $6,700 that it's at currently. And then our tier 1 drugs at $5. So obviously we feel very confident with this benefit plan design. We've looked at a lot of other competitors, talked to our owners, and looked at where the high utilization was, and we tried to match benefits to reduce that out-of-pocket expense to Medicare beneficiaries. And then our Platinum plan, a $29 premium. This is a 30% premium reduction from where it is currently. And where our premium is currently, we had some of our highest growth in 2019 within our Medicare Advantage line of business that we've seen in a 10-year period. So we thought, well, if we saw that kind of growth with the premium where it's at, what's going to happen if we dropped our premium? So a 30% reduction in our premiums. We're very excited about this, and we'll have a lot of marketing materials touting the low premium. $0 primary care visit, the $20 specialist is still there, $0 lab and X-ray, $200 outpatient surgery, $4,200 medical maximum, and then the $0 tier 1 drugs. In addition, we always want to make sure that we highlight some things that are unique to, that we believe are unique for CommunityCare. And that very first one, worldwide coverage for both urgent care and emergency services for our Medicare Advantage product line. We want to make sure our members, regardless, it's one thing we hear a lot from Medicare beneficiaries as well. What if I'm traveling or I'm out of state seeing grandchildren or children? Worldwide coverage. We offer preventive dental coverage. We have non-emergency transportation benefit for doctor's appointments at a very, very low copay. We're very happy with this. It services all of our different service areas, and something that we hear all of our members really appreciate. And then that very last point, almost all of the specialists do not require a PCP referral. So while we're an HMO plan, Medicare Advantage plan, we do not require the specialist referrals like some other HMO plans do. And then new for the Platinum plan, and that's the $29 copay, our buy-it plan for 2020. This is the first time we've ever offered these benefits. We'll be offering a hearing aid rider, or hearing aid coverage, over-the-counter quarterly benefit coverage, and then a vision hardware benefit as well. And all of those are new for 2020. There are additional benefits that are new for 2020 that we'll be discussing later on. Today we're giving just a quick sneak peek of what all is included. So our commission schedule is at the maximum that CMS allows, so $510 for new, $255 for renewal. If any of you all have seen our broker contracts, and some of you have already emailed us about this, there's a clause in there that talks about it's payable 120 days after effective date. And obviously for CommunityCare first launching, most of our effective dates are all going to be January 1st of 2020 for the first commission payment. Our intention in that very first line here, we don't want to have any situations of having to collect money back from agents. Once we issue a check, we want that to be the final check we're issuing. We will absolutely be revisiting this policy in future years and maybe even future months in 2020. But right out of the gate, because this is a brand new program for CommunityCare, we don't have any agents with ongoing commission cycles. We wanted to set something up that would prevent any clawback scenarios and collecting money back. That's the reason for the 120 days. However, if we can get the CMS disenrollment as well as the confirmation for new versus renewal earlier, we will pay as soon as we have that. But that's really the reason we set it at the 120 days. We didn't want anything in the contract mandating an earlier payment cycle and then having to collect money back. Obviously, at the end, we'll wrap up here in a second. We'll take questions. Happy to answer any questions you all might have. But this is something we're launching right out of the gate for us. And then in addition, the commissions are only payable for senior health plan. We are actually reworking our Medicare Advantage. Those premiums are higher, the benefits aren't as rich. We put all of our investment as an organization into senior health plan, which are the two products that I just reviewed earlier. So our Medicare Advantage product line, which only has a couple of thousand enrollees, we will not be paying commissions on that. We don't want, I'm sorry, Advantage Medicare is the name of the product. We're not wanting a lot of growth in there, so we're not paying. And then also our standalone PDP product, we are also not paying commissions on. We just launched that for the first time this year, January 1st of 2019. So 2020 is only our second year. We want a couple more years under our belt before we begin paying commissions to make sure it's a long-term product for CommunityCare as a standalone PDP. And then finally, existing CommunityCare members for this first year are not eligible for commission. So we want to make sure we're very clear on that so that people aren't surprised later. In the future, we will absolutely look at revisiting this, but for this first go around, our existing CommunityCare block would not be eligible. Final couple of slides here. We are setting up a dedicated phone line and a dedicated email for our broker agent partners. So you will have direct access if you're on site with a Medicare beneficiary and you need a quick answer. You will have an exclusive phone number to call that will be manned to answer your questions on particular products or networks, premium, or even phone enrollments to help you. And then email, if you will have a dedicated email where you can send all of your applications electronically, and then we will process on your behalf and make sure that everything is configured in our system. And then finally, we'll have a dedicated service, a service rep that focuses only on our broker agents that can deliver marketing materials, take care of escalated issues, help with PCP selection, whatever it might be. There'll be a dedicated service person that will help you with your book of business. So this is our last slide, and this is just an overview of the timeline of events. Obviously, this is being our first ever broker launch. We want to make sure that we complete everything on time and help answer all of your questions. So the very first thing we're working on right now is executing all the agent agreements. We have all of those out. If you do not have it yet, talk to Josh at the end of the call. They have all of the copies. So we want to make sure we get all of our agents appointed directly with CommunityCare. And the second is to complete compliance training. If you have already completed AHIP, we will accept that as your compliance and then have you sign an attestation form. Then there will only be, if you complete AHIP, then there's only 2 small modules that you'll complete for specific CommunityCare training instead of the normal, I think 8 modules you would normally have to complete. And then finally, we will have you attend a product training seminar. Josh, I'm sure we'll talk later about one we are launching with the brokerage. That'll be our very first product training seminar that we will launch. And then after that, we'll get to it, and then we'll be here to answer any other questions that you all might have. So with that, that is the entire presentation. Josh, I'm not sure if anybody's asked any questions, but we'll stand by for questions they may have.
Yes, Josiah, thank you so much. We did have a couple questions come in. The first question was regarding existing CommunityCare members. If we help someone enroll and they are already a member but enroll in the same plan or change CommunityCare plans, do we become agent of record and receive commission?
So the answer is no to that, and in the future we may revisit. I'm sure, as you all can appreciate, as we were working on budgeting out our premiums and our rate increases and then running everything through CMS, focusing on new CommunityCare business was the area that we felt most comfortable going after. However, in the future, yes, if you are working with an existing CommunityCare member, we will absolutely be revisiting that. But for now, the answer is no, there would not be commissions paid on that.
Okay, great, thank you. The second question was, will career agents have access to plans that are not available to broker agents?
Not sure I understand that question.
Yeah, what can you explain career agents?
Yeah, well, any of your internal agents, direct agents.
No, they will all be treated the same, and we have set up their commission cycle so they are not in competition with our external broker agents. So our internal sales reps will be here to help you and assist you. They will be on the phones only, so we're not going to have them, well, there might be a couple of times they have to go out to one of our owners for something, but for the most part, they will be exclusively on the phones, and we want our broker partners out in the field doing seminars and marketing and having booths. So they will not be in competition, and no, they will not have any exclusive access to other plan designs or other offerings that our external agents don't have access to.
Okay, another question just came in. What if somebody switches from CommunityCare to another plan like UHC, and then we sign them back up on CommunityCare during the disenrollment period next year? They're referring to the OEP here. Would we then become agent of record?
That is a great question. Let me talk to our compliance officer about how that would flow through. We want to, obviously, we are very aware of all the CMS requirements and are wanting to make sure that we handle everything by the book and very carefully. So, Josh, let me research that, and I will send you back a note, and then you can follow up with this group.
Okay. Okay, John, I've taken note of your question, and we'll make sure to email you directly with that response. The next question that came in was just, could you define CommunityCare members? Is that just Medicare members, or is that speaking to group membership as well?
That's a great question. Thank you for the clarification. That is only existing CommunityCare Advantage members, only Medicare members. All of our group business, individual cover, all of those are up for grabs, and we would welcome your assistance in helping to convert them and helping them age in.
Perfect, perfect. Okay, that's all the questions that came into chat right now. Again, everybody's in a listen-only mode. If you have any questions, feel free to put them in chat, and we'll make sure to get them answered. One thing that I just wanted to mention here is Josiah mentioned that we'll be doing a full-blown product rollout. So stay tuned for more details on that. We should have communication coming out here soon, but we will be hosting the official product rollout for CommunityCare later this month. And that's where you will see all of the benefits unfold and get to meet with us and our local partners And there we're going to talk more about some of our programs. So as I mentioned, the Brokerage Bucks program, if you do 8 CommunityCare enrollments for any effective date, you will get a 1,000-piece mail campaign to promote to more CommunityCare membership out there. And that goes for any carrier. So all of your enrollments would go in together for that 8 total. I just wanted to reemphasize that. And, you know, by the way, contracting is open now. You can contact our office directly, 469-635-6000, or you can email me directly at josh@thebrokeraginc.com. That's josh@thebrokeraginc.com, and we will get a contract out to you today. You can also reach out to one of our local partners. That's Travis Branch and Tom Mays with Local Insurance Advisors, or Michael Stevens at Tallgrass Benefits, or Craig Corbett at Centennial Insurance. So these are our local partners on the ground there to help you with training and support. We did have one other question that came into chat here. So first commission payments for new enrollments effective January 1st would occur in April 2020. Is that correct?
Yes, if not, and yes, and if not before. So that should be our maximum payable to get through disenrollment and CMS confirmation.
Okay, thank you for that. And there's another question that just came in. Will there be any expansion counties for 2020?
Not for 2020. That map I showed earlier, actually I can go back to that. This is our current service area map for 2020. It'll be 2021 that we begin looking at expansion counties, and we already have 3 targeted that we're working on right now for 2021. But this is our 2020 service area, the ones that are colored.
Got it. All right, I don't see any other questions in chat. This webinar will be recorded, by the way, and a copy of it will go to all attendees. We'll also post it on our website, so if you wanted to come back and scroll through these benefits. Josiah, are you able to share this this deck with me?
Yes. Yeah, I'll send it to you shortly, Josh.
Okay, we will also upload this on our website, and it'll be password protected because all of this information cannot be exposed to consumers until 10/1. You would have to log on to our website at www.brokerageinc.com. Just sign up and register, and we will give you access, password protected behind the curtains, and we will have this uploaded within the next 24 to 48 hours so you can come back and review this information. One last chance before we end the call for any other questions that may come up in chat. We'll give you another 20 seconds here. Josiah, any other closing comments?
Well, I just want to say thank you to everybody who is either already contracted with CommunityCare or considering a contract. We are very excited. We feel like this is history-making time for the organization, and look forward to partnering with all of you. If you have other feedback for us, like I said, Josh at the brokerage, they've been very helpful in creating unique opportunities for us to think through as we've been developing this program. So we welcome other feedback. We want to make sure this is a win-win offering for our agents and CommunityCare, and then ultimately we want to make sure we service our members well. So thank you.
Oh, absolutely. Thank you. We really appreciate the partnership. We know that, with the marketing that we can provide from our national footprint, as well as with our local support, with the marketing programs we have available and our just fabulous contracting team that can help you guys get contracted just as quick as possible. We're real excited about the partnership, and we know that it's going to be a successful 2020. So again, I didn't see any other questions come up in chat, but we really appreciate your time here this morning, and you guys have a great day. Thank you again.